Hi everyone, and thank you for joining today's webinar. I'm Lauren Diffendarfer, the medical educator here at the DIS Foundation. Today we're going to discuss how to control bleeding, as well as how to help someone who's experiencing a nosebleed. Blood loss often gets the most attention. Many times the amount of bleeding is overestimated and draws attention to wounds when more serious injuries should be dealt with first. Whenever confronted with bleeding, perform a quick overview of the person to make sure something more serious is not being overlooked. Always use personal protective equipment prior to caring for an injured and bleeding person. The person can be instructed to perform self-care while you put on your personal protective gear. Examples of personal protective equipment include gloves, gowns, goggles, and etc. To stop bleeding from a wound, use your gloved hand in a dressing to apply firm and direct pressure to the injured area. Continue to hold the pressure until the bleeding stops. In the case of multiple wounds, apply pressure dressings to the worst injuries first and then to the lesser ones. The victim may be able to temporarily assist by holding pressure on some areas. Very small wounds such as scrapes can heal more rapidly using an antibiotic salve. Ask the victim if they have any allergies before using. Thoroughly wash minor scrapes and abrasions with soap and water before bandaging. Massive bleeding can occur due to extreme injuries such as open fractures or deep lacerations. When the direct pressure does not control bleeding, a tourniquet may be required. Tourniquets can consist of a blood pressure cuff, belt, or pre-made versions. Although commercially prepared, tourniquets are effective than improvised ones, if none is available. One can be made quickly using a piece of cloth and a stick-like object. Understand the application of the tourniquet is painful but may be necessary to prevent life-threatening blood loss. Tourniquet use is difficult and can be dangerous if done incorrectly. Direct pressure should be applied first. To apply one, put on personal protective gear, apply approximately 2 inches above wound, tighten until the bleeding stops, record the time it was applied, call 911, stay with the person and do not release until advanced help assumes care. Certain situations may produce massive internal bleeding that is not visible when examining the person. This may occur from trauma, falls from height, car accidents, or crash injuries. Penetrating injuries caused by a knife or gunshot may produce devastating internal bleeding with very little external blood loss. In this case, immediately call 911. Help the person lie down and remain still. Check for signs and symptoms of shock. You may need to cover the person to keep them from getting cold, and then stay with them until advanced help arrives. Now we're going to discuss how to help someone with a bloody nose. Nosebleeds can be quite dramatic and often messy. Be sure to wear personal protective equipment and eye protection when attending to nosebleeds. Victims of nosebleeds often swallow a fair amount of blood, which may result in vomiting. Therefore, you should prepare for the worst. To help someone with a nosebleed, ensure the scene is safe and put on personal protective equipment. Press both sides of the nostril just below the bony portion of the nose for a minimum of 5 to 10 minutes. If bleeding continues, try holding pressure for an additional 10 minutes. If bleeding still continues after this, seek further medical care. If the victim has trouble breathing or shows signs of severe distress, call 911. Don't forget, we offer online CPR certification on our site. You can find a link in the description. We encourage you to become certified as soon as possible, either in a classroom or on your own time with an online course. Thank you guys so much for tuning in today's webinar. We hope that you enjoyed it and catch us next time for our next one.